Hi, I'm Degé Coutee with Patient Advocacy Network at cannabissaveslives.org, and this is your weekly edition of the Compassion Flower Report. These are the headlines we will cover from this week. Let's start internationally. This is from the Marijuana Business Daily. First medical marijuana shipment from Jamaica heads to Canada. A Caribbean company has sent the first ever shipment of medical cannabis from Jamaica to Canada for analytical testing, marking a watershed moment that portends significant growth in trade between the countries, executives say. Jamaica's Timeless Herbal Care shipped extracted cannabis oil to Sinfine Research, affiliate of Toronto Research Chemicals, both licensed dealers with Health Canada. It was the first test shipment to create a pathway from Jamaica to Canada, Timeless Herbal Care CEO Courtney Betty said. We think that with the shortage of medical cannabis in Canada, Jamaica is going to be a great option, he added. Timeless Herbal Care was one of the first licensed producers in Jamaica since Jamaica passed the ganja law in 2015, legalizing cannabis for medical or therapeutic purposes. The country's medical marijuana industry has been a center of growth. Jamaica's Cannabis Licensing Authority has issued 22 licenses, and an additional 126 are at the conditional approval stage. Canadian medical cannabis businesses see increasing opportunity in Jamaica. Medical cannabis markets are expanding in the Caribbean. Neighboring Cayman Islands approved medical cannabis imports and sales in 2016. Antigua and Barbuda are drafting legislation to legalize recreational and medical marijuana sales. I thought this was really exciting and very interesting. Here we've got licensed producers in Jamaica who are sending their product to Canada, where it's saying that there's a shortage, and I'm assuming that the product is being tested in Canada to make sure it meets Canadian standards, and it'll be determined if it can go on their market. This is interesting to me because while I do focus a lot on the regulatory aspect of businesses in different states, the different states' laws that regulate cannabis operations there, I know very little about what law allows a shipment of concentrated cannabis to go from Jamaica to Canada to be tested and then purported it's going on to the Canadian market. So I don't know, was there a change in laws that allows this to happen? Are Canada and Jamaica just making up their own rules? I want to look a little bit more into it because, again, I do find it very interesting. And again, the other thing is that it talks about what other growth is happening in the Caribbean around medical cannabis laws, as well as legalizing recreational use. So that's our international headline for this week. Again, I'll read it again because I just like the headline. First medical marijuana shipment from Jamaica heads to Canada. I like that. Okay, this one is out of Hawaii. It's a federal story. It's a story here of the United States. It's from Big Island, now out of Hawaii. Congress asked to address medical cannabis baking conflict. A story that we've heard about quite a bit. This is asking for legislation. It says questions have always loomed about dispensaries here in Hawaii will be able to use banks locally to safeguard their cash reserve. Hawaii Commissioner of Financial Institutions, Iris Ikeda, joined a coalition of 13 state banking regulators led by Pennsylvania's Robin L. Weissman, asking congressional leaders to consider legislation that creates a safe harbor for financial institutions to serve businesses operating legally under state law. Commissioner Ikeda and regulators from other states sent a letter to Congress describing the well-documented conflict between federal and state law, which has created barriers for financial institutions desiring to serve businesses involved in licensed cannabis activities. So, again, just a story out of Hawaii. They've got dispensaries. They're now grappling with this issue of businesses just having cash on hand and not having anything to do with it. What I find interesting about this story is it's not coming from the business operators who are dealing with having to conduct an all-cash business, and it's not coming from legislators who are concerned about safety issues of there being businesses that are running as an all-cash operation. This is actually coming from bank regulators stating that they are representing financial institutions desiring to serve businesses involved in state licensed cannabis activities. I'm sure if cannabis businesses could use banks, there's payroll services, there's opportunities to save and invest and take out loans and all of these things, and that it would be really healthy. I think credit unions should be all over this. So this was, like I said, just a little story out of Hawaii, mentioning yet again that they're recognizing their dispensaries there don't have any place to put their money. And we'll see if at the beginning of this next legislative session or here shortly, we see a new bill being introduced. This story is out of Time magazine, and it's also a national United States story. And it reads, "Courts are beginning to rule against employers who discriminate against medical marijuana users." And this is out of Hartford, Connecticut. Healthcare worker Caitlin Knopfsinger told a potential employer that she took medical marijuana to deal with the effects of a car accident. But when a drug test came back positive, the nursing home rescinded her job offer anyway. A federal judge last month ruled that the nursing home, which had cited federal laws against pot use, violated an anti-discrimination provision of Connecticut's medical marijuana law. It was the latest in a series of clashes between U.S. and state laws around the country that came out in favor of medical marijuana users trying to keep or obtain jobs with drug testing employers. That's my dog in the background. He must see a buddy passing by. The Connecticut decision was the first ruling of its kind in a federal case and followed similar recent rulings against employers by state courts in Massachusetts and Rhode Island. Advocates hope the new decisions are a signal of growing acceptance of medical cannabis value. I'm going to let him out. Excuse me for a second. Come here, baby. Come here. I left this open for you. You should be able to open that. Pampered pooch. Usually he can let himself out, but not right this moment, of course, right? So we have had some other cases that have not gone in the favor of the employee, but the judge has ruled in favor of the state, and those have all been on the West Coast. So this is showing that on the East Coast that there have been a handful of cases that have been ruling in favor of the employee or the potential employee. It's really good news for medical cannabis patients. There is such a stigma that for some reason it's okay to take opiates or other pain pills or other drugs in general that have side effects, but somehow a person who medicates regularly with medical cannabis is somehow not fit to do a job or something of that nature. Everything, there's a limit to everything, nothing in excess. And I think that responsible medical cannabis users know exactly when they need to use it, how much they need to use, what form they need to use it in, what strain works best. We've all had to learn that for ourselves because, for those of us who do and desire a very productive life, we want cannabis to complement our health and not be a detriment to it or keep us from living to the potential that we want to. That's what using medical cannabis is all about. So we'll see if those cases continue. Another thing that I've talked about on this show, and we did an entire episode about it, was these some of the new data coming out about the trends of adult recreational sales versus medical sales and how these two industries are doing parallel to each other. This is another headline about this particular topic. Legalized recreational marijuana won't kill medical marijuana. Sales trends and the potential for stronger versions of prescription cannabis offer medical marijuana providers hope. This is from a site called Real Money, realmoney.thestreet.com. And I won't read you the actual article just because there's a lot of numbers in it and a lot of percentages. And I don't think that that's really the important part of the story. But what is important is that the story cites a report called The Economics of Adult Use Marijuana on Medical Marijuana Markets. The data was collected from 321 dispensaries across Oregon, Washington, Colorado, and Nevada. And the data was collected through a software known as MJ Freeway, which is one of the tracking softwares that must be approved in those states to handle the seed to sale tracking. So what the article says about the report is that soon after adult recreational sales took place in those states, there was a dip in medical marijuana sales. And after a few months, there was a significant recovery back up the other direction. And that is why they say that it's not going to kill marijuana sales. And they go on to talk about the pharmaceutical industry, which I don't know how that's going to help. I mean, certainly I don't know how that's going to help mom and pop dispensaries. The pharmaceutical companies getting in. I'm not anti-pharmaceutical. I think there are certainly some pharmaceutical applications for cannabis, as well as supplemental and nutritional and therapeutic. And I hope to see regulation that will an industry that's broad and cannabis is produced and distributed and consumed in many different ways. This is what the data collection process can't account for in this report, The Economics of Adult Use Marijuana on Medical Marijuana Markets. So a couple things that this data collection process can't account for is, one, generally right before new rules take effect, whether that's new testing rules or new taxes being implemented or anything like that, patients will tend to stock up. They will go into their favorite retail outlets right before those laws take effect, and they will, about 2 weeks before the laws take effect, they will go in and stock up. So prior to any tracking software being mandatory, they would not know. They just aren't going to see that prior to the tracking software that there was probably a large spike. And what happens is the new laws take effect. They start doing the, okay, adult recreational is in effect. Let's track the new trend in medical. And I don't know that the software necessarily is accounting for that spike, and that patients are probably set for several weeks, a couple months before they need to start going back to their dispensary again. The other thing that the software can't account for are what we call patients without recs. And there is a percentage of patients out there that do not renew their recommendation after an adult recreational law takes effect. So it doesn't mean that these people are no longer patients. It just means they're no longer choosing to get a recommendation. So, there's a significant number of adult purchasers. So from the perspective of the state revenue, looking at the way the income is brought in, that this is an adult purchaser who is actually a medical or therapeutic user. And there's no way for the software to know that. So while it might look like adult recreational is going up and medical is going down, it may be very much the same. It's just the consumer is choosing to not identify themselves as a patient. And if they're over 21, nothing requires that they do so. So I think that those are other factors that those are some of the factors that affect, I think, how some of these numbers came in this study. I'm sure the numbers are accurate. I just think there's some reasons for them. If you notice, California was not part of this study. Most researchers seem to know that based on California's laws. Our numbers are kind of a cluster. So there is another factor that, of course, can greatly affect sales numbers, and that's the lack of good law, the lack of reasonable law, the lack of workable law. So let's get into these stories from here in California, where Patient Advocacy Network is located. So right after uploading last week's show, California Governor Jerry Brown began signing or not signing a slew of legislation that passed through the California legislature. So through last weekend and into Monday, Jerry was either choosing to sign or choosing to veto numerous bills. And some of those included bills that affect medical cannabis here in California, as well as the cannabis industry in general. So let me just read you these headlines real quick, and then we'll talk about the impact and implication of this. California Governor Jerry Brown rejects slew of marijuana and drug reform bills. The tragedy of SB 829, California's lowest income pot patients hit hardest. Veto of medical marijuana donation bill prompts outcry. So yes, in one of these headlines, that was SB 829, the compassionate care bill that you've heard me talk quite a bit about recently on this program. And one of the other bills, SB 1127, and this would have created a state law protecting children that need to take medical cannabis to school, like kindergartner Brooke from Santa Rosa with Dravet syndrome, who just got a judge to rule in her favor. This is the headline that we read from last week. Judge rules Santa Rosa girl taking medical cannabis for seizures can attend public school. Tears streamed down Jana Adams' face Friday when her attorney delivered the news by phone that her 5-year-old daughter, Brooke, can continue attending public elementary school and bring with her the cannabis-based medication she needs. So 1 week later, Jerry Brown has yanked the rug out from underneath this family, which will in fact yank this little girl out of school. So last week, tears of joy. This week, tears of pain. And it remains illegal in California to give medical cannabis away at no cost to vulnerable Californians. WHAM, the Women's Men's Alliance for Medical Marijuana, will remain closed. And I just learned that another compassionate provider in Sacramento has had her doors closed since May. So I'll include the links to those stories below. Like I said, I'm not going to go into reading them. We know what happened. Jerry Brown did not put pen to paper on some important compassionate bills. He cited legal reasons. He did not think it is legal to allow a child to have medical cannabis on a bus or at a school. They can certainly have other dangerous drugs with side effects at school, but not medical cannabis. That's primarily CBD. I know this one child, Brooke, she does take a THC CBD blend, but it would be handled by the nurse, brought on campus by the parent, things of that nature. Like I said, I'll put the other legal reason with SB 829, as Jerry Brown said, that he didn't think it was the intent of the voters for cannabis to be given away to free to for medical cannabis patients. So now it's the ripple effect from that. And as you know, lately I have spoken quite a bit about the fact that in my capacity with the Patient Advocacy Network, I have taken it upon myself to reach out to many patients around the state, many of them being more vulnerable, lower income, because those are the patients I work with, and wanting to learn from them what their experiences have been since the new laws have taken effect. And as I've reported on this program, I have yet to speak with one patient that is still getting their medical cannabis from a licensed retail outlet. And again, retail operators that have been around for many years report to me that their patient members stopped coming in right after the major tax increase on January 2018. It's basically been a quiet boycott by patients. And it's not only patients. Pan has written a brief blog post about this. You can find it at Cannabis Patient Voice. That link is also linked up down below for you. You can check out that blog post. But we talk about what the market withstands, and that cannabis consumers, whether they're patients or adult recreational users who are here in California, who are used to what California prices are, and that's generally $35 for a decent mid-grade eighth, all the way up to maybe $65 for a more premium eighth. Although I haven't seen 65 in a long time, I've heard that it's still out there. So that's your spread. That's your $35 to $65. That has also been the same price range on the unregulated market. And so now that the regulated market is more expensive than the unregulated market. Consumers are doing what consumers naturally do. They vote with their dollar. And so that is why patients, and not just patients, like I said, there's still, there were dispensaries that said that when the laws first came in, laws first took effect and they had their A licenses, they did see local people who were over 21 who came in to check them out, but they didn't stick around for very often. And in this blog post that we put up, weed sells, but who's buying, we get into this issue that we have here in California, that dispensaries are mostly being visited by tourists. So you've got this added frustration from consumers now that Jerry Brown has decided to not sign SB 829, not sign SB 1127. And there was also a bill that would have reduced some of the taxes. And it's created now what's gone from a quiet boycott to more vocal opposition. And that opposition is being directed toward licensed providers and those in the licensed industry, which I don't necessarily see it as those licensed providers' fault. And many of them are doing everything they can to provide a good environment and a nice atmosphere and a good company within the industry and provide jobs and these kinds of things. However, there's a couple things here. You've got some people who are angry at the licensed businesses, arguing that somehow Prop 64 even getting on the books is somehow their fault, that their greed and their desire for adult recreational licenses caused them to stick their head in the sand and overlook some of the more troubling and problematic provisions, which has led us in this mess today. The other part of it is, again, it's that voting with your dollar. It is so much easier to just spend your money at the, if the new prices for the same quality, if it's $50 at the dispensary plus 25% and up sales tax on that $50 eighth, or you can get the same quality eighth for $35 someplace else, people just vote with their dollar. And I think that's the other thing, is people are frustrated with the laws. It's much easier to vote with your dollar than it is to go up to Sacramento and try to change these laws, which is basically what we need to do. So what does all this mean? What happened this week is we really started to see exactly how Prop 64 was crafted in such a way that the protections under Proposition 215 could very easily be eroded. WHAM is closed. Compassionate care doesn't exist in California on the books anymore. The provision in Prop 215 that mandated that medical marijuana be affordable is being completely ignored and tromped on. So what does this mean? Well, it means that we're going to have some pretty serious changes. And it means that we are probably going to have to take some very active measures to protect Proposition 215. And I'm going to save that topic and discussion for another edition. I want to thank you for watching. I want you to know that all the stories and many more that we talk about here are available for you on our Twitter at Pan for Compassion. That link is below. You can sign up for email updates at cannabissaveslives.org for news and action alerts and more. Please donate. Patient Advocacy Network is an educational 501c3 organization. Your support is always tax deductible. Visit our website at cannabissaveslives.org and please click the donate button. Choose a monthly amount that is right for you and become a regular monthly sponsor. Our work is much more effective when you do so. Please like, subscribe, and share this video. And until next week, I'm Degé Coutee with the Patient Advocacy Network.